Obwomu tobuteka matiga. Abantu boogera bingi ku bujanjabi. Tikozesa buno, kozesa buli. Tibuwonya kino, buwonya kiri. Manya nti buli bujanjabi bubanga ebirungi n'ebibi.
Hello and welcome to the fourth episode of the Health Choices program. The program is brought to you by Makerere University College of Health Sciences.
In many health programs, people tell you what health choices to make. In this program, we present some common things people say about treatments, and we explain why some of these claims are trustworthy and why others are not.
You can use what you learn from this program to choose for yourself what treatments are right for you.
Everywhere, there are people making claims about what we should do to feel better, look better, and live longer. Many times, what they say is not trustworthy.
Remember, most treatments have both good effects and bad effects on your health, and lots of treatments are not as effective as people claim.
In this episode, a lady named Gloria and her husband George are at a village meeting and ask about a claim that the couple has had. In their village, people claim that taking birth control pills causes women to gain weight.
The community health inspector, Mr. Magala, explains why the claim is not trustworthy. Please pay close attention to Mr. Magala's explanation.
Silence! Silence! As we conclude our monthly meeting, are there any other issues that anyone would like to discuss?
Mr. Magala.
Yes?
My wife and I have a question.
Okay, please, go on.
Now that we've just had our firstborn, we were planning to resume using contraceptive pills so that we allow our baby enough time to grow up before we have another. But one of my friends said that a lot of women gain weight when they take contraceptive pills. She said they could cause me to gain weight. Is this claim true?
No, Gloria. That claim is not trustworthy.
How are you so sure, Mr. Magala?
There is only an association between using the birth control pill and gaining weight. But that does not mean it is the pill causing women to gain weight.
What is an association?
An association between using a treatment and an effect occurring means that people who use the treatment sometimes experience that effect. But that does not mean that it is the treatment causing the effect to happen. Some women who take birth control pills gain weight, but this does not mean the weight gain is caused by the birth control pills.
I see. So what you are saying is that there is an association between taking birth control pills and gaining weight. But that does not mean it is the pills that are causing those women to gain weight. Then, what could be causing women who use birth control pills to sometimes gain weight?
There could be other things causing some women to gain weight when they take birth control pills. For example, it is possible that most women who take birth control pills are at an age when they would naturally start to gain more weight.
Oh, so it could be that with or without the pills, they would have gained weight.
Very good. In fact, we can be very sure that birth control pills do not cause women to gain weight.
How are you so sure?
I am sure because health researchers have scientifically compared what happened in large groups of women. In those comparisons, only one of the groups got the contraceptive pills. The other group did not get the pills.
And what happened?
The health researchers observed the two groups of women and found that taking contraceptive pills does not cause women to gain weight.
Oh, I think I am starting to understand this. Mr. Magala.
Yes?
Will you please give us another example? It is important that all the people in our village understand this.
All right. Now, George, we are in the maize season. So people eat maize a lot.
Oh yes, we have been eating a lot of roasted maize lately.
And in the maize season, many people get malaria. So some people say that eating a lot of maize causes malaria. Does the association between eating a lot of maize and getting malaria mean that eating a lot of maize is what causes malaria?
Of course no. In the maize season, it rains a lot, so there are more mosquitoes.
I understand. Much as many people get malaria in the maize season, it is because there are so many mosquitoes in the maize season. The mosquitoes are the ones responsible for the malaria, not eating a lot of maize.
Aha! Exactly. Well done. There is only an association between eating maize and getting malaria, but eating maize does not cause malaria. Similarly, there is only an association between using contraceptive pills and gaining weight, but using contraceptives does not cause women to gain weight. It is only an association.
Thank you so much, Mr. Magala. Ekyo kati kiri clear. I'm going to use the contraceptive pills. I no longer fear them causing me to gain weight.
Mr. Magala,
Yes?
let us give you some of our maize. But do not fear, it won't give you malaria.
So, the message in this episode is that an association is a common bad reason for believing claims about the effects of a treatment.
If there is simply an association between a treatment and something happening, that does not mean that the treatment is causing what is happening.
If someone makes a claim about the effects of a treatment and their reason is an association, ask if there are other possible explanations for what happens when people use the treatment.
To be more sure about the effects of the treatments, health researchers should study the effects scientifically. They should make scientific comparisons of treatments with large groups of people.
In scientific comparisons of treatments, health researchers should give a treatment to one large group of people. Then they compare what happens to those people with what happens to a similar large group who do not get the treatment or who get another treatment.
Be careful not to believe everything people say about treatments based on only an association between the treatment and something happening.
This was the 4th episode of the Health Choices program. We hope this episode helps you make the right health choices for yourself and your family. Thank you very much for listening.
Only health research can show us the way. Ask if a health professional has done research on the treatment so that you can be more sure. Be more sure. And make the right choices.